All set? Okay, awesome. So, good morning, everyone. Thank you so much for being here early. I know that we don't technically open the doors until 8, so thank you if you had to wait. I am here with Dr. Luke Bergman, Director of Behavioral Health Services at the county, and Deanna Beck, Director of Homelessness Solutions at the county. We are all excited and proud to announce that the board has unanimously approved my proposal to implement robust solutions to support those struggling with the intersectionality of mental health, substance use, and homelessness in our communities. In my previous efforts to expand access to behavioral health services, the focus was primarily on acute psychiatric care beds, which is a short term, high level of care for people experiencing severe mental health symptoms. While those efforts are still essential, the board item that passed yesterday offers a much more broad vision. To start, this proposal includes establishing up to 30 intensive acute care beds at Paradise Valley Hospital. These beds would provide 24-hour observation and intensive treatment for individuals with severe acute mental health needs, ensuring patients can stabilize before transitioning to lower levels of care. We will also begin the search for a new partnership to provide intensive outpatient programs and partial hospitalization programs for Medi-Cal beneficiaries. These evidence based programs bridge the gap between hospitalization and traditional outpatient therapy by offering critical care for individuals without separating them from living at home. To address the urgent need for 400 board and care beds, the county will explore collaborating with organizations experienced in developing and managing residential behavioral health facilities for Medi-Cal beneficiaries. We have had organizations express significant interest in this partnership, and this effort toward long term housing needs allows us to comprehensively enhance our regional behavioral health system. A 2022 report by the San Diego Workforce Partnership revealed that our region must educate, train, employ, and retain over 18,000 behavioral health professionals by 2027 to meet the growing demand for services. The expansion of services through my proposal creates opportunities for regional academic institutions and healthcare providers to establish new clinical training programs. These programs will allow San Diego residents to pursue careers in fields like psychiatry, clinical psychology, nursing, social work, pharmacy, healthcare administration, and more. In turn, this will help produce a new generation of high quality behavioral health professionals, elevating the quality of care across San Diego County. A key focus of this initiative is strengthening community based care, both in terms of quality and capacity. By increasing long term residential care beds and expanding outpatient programs like partial hospitalization and intensive outpatient services, we can address one of the most pressing challenges in our healthcare system. Currently, many hospitalized patients are ready for discharge but have nowhere appropriate to go for ongoing care. And so these delayed discharges not only lead patients to regression in their own health, but also strain the healthcare system. These delays mean that hospital beds are occupied longer than necessary, limiting access for other patients and driving up costs. By enhancing our community based care networks, we can address these challenges and recognize that more must be done, but temporary solutions like pushing people into shelter without addressing root causes only perpetuate cycles of instability and unmet needs. We must approach these complex challenges with compassion. We cannot approach the establishment of additional behavioral health beds and treatment slots with the goal of simply creating places to put people. We need to think and act more holistically. It is absolutely critical that we are deliberate about how we build out our behavioral health continuum of care so that we meet the individual needs of every resident receiving that care. There is no one size fits all approach. That will only result in a system that is ineffective and inefficient. And with so many of our neighbors struggling, we owe it to them to do this work the right way. As I mentioned before, I have two incredible leaders within the county's Health and Human Services Department here with us this morning. I'll now introduce Dr. Luke Bergman to dive into what this proposal will mean to our behavioral health services.
Excuse me 1 second, guys. Thank you so much, Supervisor Montgomery Steppe, for your leadership with this item and with respect to behavioral health services at the County of San Diego generally. This is an incredibly important item reflecting some core principles in the county's approach to behavioral health and informed by a deep and ever deepening understanding of the kind of work that we most urgently need to drive forward. As the supervisor noted, our aim, our mission, our objective is not to simply put people into a crisis care bed that we know in short order they will leave without being engaged in long-term recovery. Rather, our aim is to create a seamless continuum that will engage people in moments of crisis, but that will then hold them in recovery over the long haul for as much of the rest of their lives as we're able. That ultimately will mean improved behavioral health in the county generally. And the way to do that is exactly this kind of broad investment that we see with this item. We are bolstering capacity in the county to care for people on public insurance in acute care settings at Paradise Valley, as the supervisor noted. But very importantly, at the same time, we're bolstering aspects of our continuum that will enable effective discharge and ongoing care for those patients. The state has very recently made available a reimbursement for people enrolled in Medi-Cal in intensive outpatient or partial hospitalization settings. This is absolutely cutting edge work in the state of California. We are the first county to engage in actually developing a service that would use this recently developed reimbursement for people on Medi-Cal. We're diving in right away to take advantage of this critical opportunity to keep people in recovery as they leave acute care settings. The long-term care component that the supervisor mentioned is probably the area of work that's most critical for the county. We see so often, exactly as the supervisor noted, that even when people are ready to be discharged from acute care or subacute care settings, there isn't a place for them to go that has sufficient support for them to live their lives. The kinds of long-term care settings that we're talking about here are not clinical. They are places where people can live lives with a sense of agency and purpose and with support. The support ongoing that people with serious mental illness and very often co-occurring substance use disorders need. So again, across the array of services that the supervisor is addressing with this action, we see very meaningful opportunities for progress, not just in engaging people in moments of crisis, but in holding them in recovery over the long haul, which will enable us to see actual improvements in the behavioral health of our community. Thank you.
Thank you so much, Dr. Bergman. Always appreciate you being here and kind of diving a little bit deeper into how these issues impact us and why this item is so important. So next, I would like to introduce Deanna Beck, who is the Director of Homelessness Solutions in the county.
Thank you, Supervisor Montgomery Steppe, and I'm honored to be here today. Good morning, everyone. My name is Deanna Bagg. I'm with the county's Office of Homeless Solutions, and as you heard Dr. Bergman and Supervisor Montgomery Steppe say, the need to improve our behavioral health care accessibility for our entire community is urgent. Behavioral health issues touch many lives, including San Diegans experiencing homelessness. Homelessness on its own is a very complex issue, but it's very root. It's an economic hardship. Within county government, my team from Homeless Solutions serves as a central point of coordination with the key internal and external stakeholders. Our outreach teams are at the heart of the county's response. They interact every day with people living on the streets. And by repeatedly engaging with people and building rapport and trust with the unhoused people, they hear with every interaction a person's story. Each person has a unique story and the journey that led them to experience homelessness. All the stories include economic hardship and housing instability. It's no secret that San Diego County is one of the most expensive places to live in the nation. Rising rental costs and low vacancy rates are a big factor that are driving people into homelessness. We hear this every day as we interact with people who are experiencing homelessness for the first time: families, seniors, veterans, people with disabilities, youth, and many others who no longer can afford a home. Our outreach team connect people with essential resources such as food, shelter, IDs, eligible income or employment services, and medical care. These are all building blocks of self sufficiency and pathways to permanent housing. Some of the people we interact with are dealing with mental health and substance use issues. And by building trust and rapport, we're able to link these people to receive assessment and services that are currently available, including housing. And we see success stories every day. Each person's journey, as I mentioned, looks different, and the shared ultimate goal of us who are boots on the ground is to find the right combination of services to support that individual. For me and my team, we strive to use the existing resources by maximizing, collaborating, and partnering across the region. Our mission is to ensure the most vulnerable people have access to the existing system of care that addresses their overall health, including mental health and substance use issues, and ultimately reach stability. Thank you.
Thank you, Deanna, for being here this morning. Before we answer a couple of questions, I just want to say some closing remarks that, um, instead of minimizing the needs of those that we encounter or um, having a mentality of just putting people in a place, right? So that the larger public doesn't have to see the struggle and see the issues. We are really trying to build a holistic system, thereby it will produce whole people. And that is what our focus is here. um, I do want to shout out some resources for people to take the time to do that as well, because there are avenues for help out there. For example, if someone is in immediate danger of harming themselves or others, of course, call 911 and request a psychiatric emergency response team or a PERT team, which includes trained mental health professionals. And for nonviolent mental health crises, San Diego County now has 44 mobile crisis response teams available. These teams provide in person support, stabilize situations, and connect individuals to appropriate care. And you can reach the MCRTs or the mobile crisis response teams by calling 988. So today is really about building long-term solutions. Our work today, our work moving forward. We want to ensure that people receive the care that they truly need. And so with that, we'll take questions.
Supervisor, for you, this is primarily in Sharpshoe Vista, right? South Bay?
No, you may be speaking of the crisis stabilization unit that we also passed. That was on the consent agenda yesterday. This is about a few different areas, but one that was specific in the board letter was up to 30 acute psychiatric beds in Paradise Valley Hospital, which is in National City.
Okay. And I did want to ask, from your perspective, and Dr. Berkman, I'd like to pick your brain on this as well. The only thing, can you kind of comment on, why we're doing this in the first place, the need? I mean, the things that San Diegans are facing right now.
I'll turn that over to Dr. Bergman, but overall, we see it every day in our communities, but there are also people that are in need that we do not see, right? And so, again, we are building out a holistic system. Oftentimes, if we have beds at the acute care level, when the folks are no longer in need of that level of care and need to step down, we often don't have places for them to go. So as I stated, they begin in their own care to have regression, right? And then there are the beds available for those that are coming in that need that high level of care. So we have to, if we don't want to continue to play whack-a-mole, right? We really need to build out the continuum of care. And, we're asking everyone to dig into the issues with us, because as much as we would like it to be very easy, it's just not. It is not. And we need, especially as Dr. Bergman said, the board and care facilities where people can actually live out their lives, right? So that we don't have people in these higher levels of care that are costing the system a lot more and not beneficial to the people that are there. And so as we confront these issues within the homelessness community and outside of the homelessness community, our job is to look at it all and not be reactive, but be proactive in building out an entire system. And I think that that's what the public deserves. So I'll turn it over to Dr.
Thank you so much. I endorse everything that the supervisor just said. I would add that the most common chronic illnesses that we face as a public, and this is true of San Diego, it's true of the state of California, it's true of the nation of the United States. The most common illnesses that we face are chronic illnesses, and the most common chronic illnesses are behavioral health conditions. 1 in 5 people in this county, as across the state, as across the nation, suffers with a mental health or substance use disorder. Substance use disorder just on its own is more common in the county of San Diego than type 2 diabetes, right? Which we think of as a very non-stigmatized chronic condition that is sort of well treated in all kinds of care settings, that are not sort of seen as problematic, that are not seen as opportunities for crisis intervention, but are seen as settings for ongoing care, right? And that's the approach that the supervisor is outlining with this item, and that's the approach that we need to turn towards in caring for behavioral health. There are things, of course, that drive a kind of preoccupation with crisis among those with behavioral health conditions and among the response that are different with physical chronic illness, right? Behavioral health conditions are so stigmatized that historically it's been difficult for us as a community, for us as a nation, to think about them in any way that doesn't involve the notion of crisis. It's very much the stigma that drives a preoccupation with crisis that has driven the development of a care system that's all about crisis and not sufficiently enough about ongoing care, about ongoing recovery for what we know are chronic conditions.
Any other questions?
If you could just talk about how, this will be care for everyone and not just people who can afford it, but people who can't afford it.
I'll do my routine, which is to turn it over to Dr. Bergman. But before I do that, I do want to say, as you noted, throughout my what I am talking to you all about and what we talked about yesterday was access for Medi-Cal beneficiaries. And a lot of these, the programs that we're talking about, the treatment that we're talking about is not as accessible to folks who are on Medi-Cal. And so there are quite a few people who are recipients of this public health care system that are low income, because they pretty much have to be a recipient, and are not receiving the type of care that is going to make them a whole person, right? And that is a really big goal. It's really our only goal, because that is the program that we administer, right, as a public health agency of the region. And so that is very, very important, and that is a distinction. A lot of this program that we are talking about is available to people with traditional insurance, and is not as available, and especially with the quality that is needed, to those who are Medi-Cal beneficiaries. So that is the primary focus for us. I'll turn over to Dr. Bergman.
Again, bringing endorsement for everything that the supervisor just said. I mean, you know, what the supervisor emphasized at the outset is that this is about access and this is about quality. And it is pretty well known that in a lot of quarters, there are two behavioral health care systems. There is a public system and there is a private system. And the private system is infused with lots and lots of resources historically. Generally, the public system is not. The public system has struggled to get flowing into it the kinds of resources that people whom it is charged to care for need. I think the prime example in this item of the commitment, not just to access, but to quality, is the recommendation to develop IOP and PHP, intensive outpatient partial hospitalization. Again, across the world of the private system, these are bedrock aspects of the behavioral health continuum that have just been missing from the public behavioral health care system. The state has now created an opportunity for us to build that up. And again, we are moving faster than any other county in the state to take advantage of that with this action. And it will begin to sort of, you know, balance the scales a little bit, to create a system where there is equity in access and equality in quality.
And then can you just talk about how long you think it'll take to kind of get these services off the ground?
That's a good question. I will turn that over to Dr. Bergman, because that is a technical question. I will just say, to preface the statements, is that this is our ongoing work. And so our behavioral health department is always working on those partnerships to produce more beds at every single level that people need them. We are directing staff to move forward specifically based on the recommendations of the item, but this is our ongoing work. And so I think this week I've been to a couple of ribbon cuttings, right, of boarding care facilities that are out in the community. We have to continue to do this work. So, Dr. Bergman.
One of the things I really appreciate about the supervisor's leadership here is a sense of urgency around timing to get this done. The recommendation to expand beds at Paradise Valley is something that we can do very quickly. So we will be taking, you know, kind of action as immediate as possible to do that work. What we're doing is working, as the supervisor noted, in the way we always do, optimizing access and quality by maximizing the resources that are out there. So what we're going to be doing is taking advantage of existing space and capacity and ensuring that that existing space and capacity is devoted to people on Medi-Cal. So that's really at the heart of that action. With respect to the IOP and PHP work, that will be procedurally a bit more complex. So we have already dug in to figure out every avenue to expedite that. And again, appreciate the supervisor's leadership and you know, taking new approaches to that kind of work. And then we've already been doing a lot of sort of technical development for long-term care as well, including infrastructure planning, meeting, as the supervisor noted, with potential parties with whom we would partner. So we're pushing that forward as quickly as possible as well. Thank you.
Any other questions? Okay. Well, thank you so much, everyone, for being. We're really counting on you all to inform the public about the complexities of this issue, but also that we're continuing to work on these issues for the benefit of our Medi-Cal recipients. So thank you very much.